Now, medical negligence is fast becoming a trend, finding spaces in the news. Recent controversial happenings in the country have led to many asking questions about the level of safety consciousness in the Nigerian health sector. In this special report, correspondent Jacqueline Ogo takes a look at how, medical negligence occurrences and expert advice.
Medical negligence is fast becoming a common cliché in the Nigerian media, no thanks to medical personnel being accused of complicity. A family in Kano State is still mourning the loss of Aisha to Umar, a housewife who reportedly died after surgical scissors was mistakenly left inside her body during surgery for the removal of a cyst. But the major one, which has strongly turned the eyes of the nation to the troubling spate of medical negligence in the country, was the death of 21-month-old Nkanu Nnamdi, son of the famous Nigerian author Chimamanda Adichie, in a Lagos hospital. He was one of her twin boys she had after 8 years of waiting to be a mom. When she went public over her loss, the news got viral on the internet. Before delving further, let's understand medical negligence. Global health bodies like the World Health Organization say it occurs when a healthcare provider fails to meet the accepted standard of care, resulting in harm to a patient, injury, disability, or death, often due to acts like misdiagnoses, surgical errors, or wrong medications, which form grounds for the call for adequate compensation of the affected individual or family. Medical negligence can also emanate from the failure to obtain informed consent from a patient before a medical procedure is carried out, or a hospital's failure to refer a patient to another hospital with better capacity to handle a challenge timely. This is because the healthcare provider owes a legal duty of care to a patient after accepting to administer treatment. The payment of damages is awarded by a competent court of law because the patient suffered actual harm, injury, loss, or death.
And I specifically asked, is this standard of care?
On the 10th of January, Chimamanda Adichie's aunt, Dr. Anthea Esege Uwandu, who is a specialist in internal medicine, was our guest on TVC News at 7 p.m. She made clear explanations about the sad loss of her family, telling step by step the process that led to the death of her nephew.
It's important to note that Nkanu was ill but stable for transfer to the United States as planned. He was taken to the MRI suites at Eurocare, where he received what we call moderate sedation. So he received IV medications to sedate him for the MRI procedure. Subsequent to that event, he was transferred by the anesthetist to the procedure room where he was going to have the spinal tap and lumbar and central line placed, off oxygen, unmonitored. That was the first incident of negligence. For a baby who was unwell, brought in by ambulance from Atlantis on oxygen, standard clinical practice demands that such a baby is monitored continuously. Unfortunately, he got to the procedure room upstairs where the spinal tap was to be performed and was found to be pulseless. So he had a cardiac arrest at some point during that transfer where he was unmonitored, and that was the beginning of his death.
Lagos State government has pledged to ensure a thorough investigation of the alleged case of negligence. But as journalism often goes from one table talk to another, I took my curiosity over the matter to the office of Professor John Obafunwa, the Director General of the Nigerian Institute of Medical Research, NIMA, who is a pathologist and a lawyer. It is proper to note that in cases of medical negligence, a pathologist acts as a critical medical expert who investigates the cause, the mechanism, the timing of injury or death, providing the objective scientific evidence necessary to prove or disprove negligence. Their role is particularly crucial in cases of alleged misdiagnoses, surgical errors, or unexpected death. On the subject matter, Professor Obafunwa had many nails to hit on many heads. First, he highlighted the importance of engaging a pathologist early to ensure no medical evidence is lost due to delay. He also emphasized the need for a coroner's inquest, which is a public court hearing led by a coroner to investigate suspicious, unexplained deaths with the aim of establishing the medical cause without assigning blame or liability. This leads to recommendations to prevent future deaths. But Professor Obafunwa did not rule out the prosecution of cases for proper reprimand and the award of damages where necessary.
Healthcare workers in general must lay emphasis on documentation, putting down everything that you've done, in some situations explaining why you've done those things, including your date, the time, and the signature. And you must be accurate and truthful. No attempt will be made to alter clinical notes. As a healthcare worker, you need to show a high level of empathy, because the absence of that tends to infuriate the relations of the patient. If there are apologies that need to be given, you must do it, admit guilt, and solve a lot of problems without actually going to the courtroom. And it's important for people to stick to their specialty. Don't delve into the specialty that you don't belong into. If you need to seek for assistance, seek for assistance. The hospital must constantly monitor errors and try to correct such errors. Government on its own needs to provide necessary infrastructure. There has to be adequate staffing, and government should do something about adequate remuneration.
As these recommendations are being presented to avert future occurrences, many Nigerians still ask if investigations of medical negligence can be trusted to be thorough and if the courts will award damages adequately where necessary. Directly, victims of medical negligence or their families can end up battling with challenges which include post-traumatic stress disorder, popularly referred to as PTSD, self-medication out of fear, emotional trauma, lack of